not suffer hot flashes like we do. Talking about when ladies experience menopause, but middle-aged men do go through hormonal changes. And we have Dr. Angela DeRosa. She's back this morning with a look at the symptoms and some ways to fix it. This is called andropause.
Yes, or I like to commonly refer to as Manopause.
There you go, right? And this is, in all seriousness, when we were talking about this in the newsroom, lots of eyebrows raised. What is this? But what's so interesting about this is if you're feeling cranky and you're a guy, or maybe you're married to someone who just seems like he's just always on edge, this actually might help to explain what's going on in your relationship.
And certainly, as we often think and joke about women going through menopause, we call andropause or manopause is actually a very similar phenomenon for men. As we start to lose testosterone, women typically start to lose it in their 30s, but men start to lose a lot of their testosterone in their 40s, and it can start off very insidiously. So first and foremost, they might see problems with irritability, apathy, they lose that mental sharpness, or they call it that killer work instinct.
Yeah.
Then they start to develop kind of difficulty working out, they take longer to recover in their workouts, their muscle mass starts to decline, they start to get the beer belly, but they don't actually drink a lot of beer. And then by the time they start to get decreases in libido or erectile dysfunction, they are already severely deficient. So it's those early symptoms that start in the 40s, and they're very common. And we often say, oh, women only go through those kind of issues, but men do too.
What's so interesting about this too is, you know, as a woman, if you're married to someone who's going through some of this stuff, this can actually be taken so much further because it's so easy for us to take it personally. We don't know what's going on. We think there might be an affair happening or something much worse. And this is fixable.
Oh, it's incredibly fixable. And you're right, is because we are very sensitive to the people that we're involved in relationships with. And if they're getting cranky and irritable, they may either attune it to us, or we may be extra sensitive to that irritability. So oftentimes we do see people starting to stray outside of relationships because they don't know what's quite happening. And I'm writing a book right now called Perimenopause, The Other Woman, and it's similar with men. As they start to lose that kind of sexual feeling about themselves and their partners, testosterone deficiency, both men and women, can lead to relationship decline.
Well, we've heard of hormonal replacement therapy with women. Is this available for men as well?
Absolutely, and it's actually very simple. With women, we have many more hormones. We have estrogen, progesterone, testosterone. But for men, all we got to do is replace testosterone. And interestingly, some men actually convert too much to estrogen, which really upsets most of them, by the way, when you tell them they even make some
Maybe we just don't have to tell them that.
But certainly they do make estrogen, and if they do, they're going to be weepy. They may start to notice increase in breast tissue. They actually get PMSy, and they don't know what's happening.
We call that pack my stuff at my house.
But men go through that too, and we can block down that estrogen conversion if we know it's there. But the most important thing to do is to replace testosterone.
And have that conversation about it.
And it doesn't mean that you're not vital and that you're not a guy and you can't get back in the game, as they always refer to.
You're still a stud, don't worry.
Exactly. So it's going to happen to all of you. It's inevitable. You just need to talk about it. And the unfortunate thing is, their fathers never talk to them about their issues. I mean, God forbid that they'd have that discussion.
Yeah, well, we can thank the silent generation for that. So when we're talking about therapy, what does this entail exactly?
Well, certainly getting full set of blood work to make sure that you're looking at normal testosterone levels, but unfortunately the lab reference ranges are often incorrect. So you may go to a standard provider who doesn't understand testosterone deficiencies, and they may tell you you're normal. So certainly seek out someone like ourselves who understand testosterone physiology. So get full set of blood work, and then talk about replacement, which can include anything from injections, creams, gels, or the gold standard, which is what we specialize in, is testosterone pellets, which are tiny compressed little cylinders of testosterone that get inserted in the subcutaneous fat in the buttock region.
Okay, I'm sitting here listening to this and like, okay, how do you even venture into a conversation with a guy about this? I mean, this could get explosive. Honey, I think you need a testosterone replacement.
Well, I always make the joke that there's two ways to get a man to a doctor: is number one in an ambulance, or number two with erectile dysfunction. But certainly, if you can broach that conversation with them, certainly explain, you know, why don't you just get your levels checked? It's certainly your weight issues might be a problem, or that you're just not feeling right, and it doesn't have to be an attack on their sexuality. Because really, sexuality is the last thing to go. There's many more benefits: working out, keeping their weight, feeling energetic, feeling strong.
And that's the last thing you want to challenge with a man.
Absolutely, but just have that conversation with them.
Okay, gosh, always a pleasure to have you here. Great insight, right? Who knew menopause existed? I just want to know why we talk so much about menopause, but this menopause thing has just been so quiet. We appreciate your time this morning.
My pleasure.